Hello, this is Stephen Dell Jones, Doctor of Oriental Medicine at Tampa Bay AccuHealth and Spine. And today I want to talk briefly about heartburn and a few things you can do to help the condition. It's a very common condition. As you know, most people at some point or another are going to experience some heartburn, some reflux. It's a very common situation, and a lot of it is related to lifestyle and dietary habits, of course. So, briefly on lifestyle habits, lately I've had a rash of people who come to me with heartburn and reflux. And I have to say that a very common situation, a very common background to the problem seems to be that they're eating in a rush, they're eating on the go, they're standing and walking around while they're eating. They're getting in their car. They're rushing off to work. And of course, with today's modern hectic lifestyle, people are always on the go. But see, the stomach says I can either rest and digest, or I can fight or flight. So in modern terms, fight or flight is you got to battle traffic, you got to rush, you got to work, you got to deal with deadlines. But when you're rushing and you're pressing yourself, your stomach just doesn't get the opportunity to break down the food the way it should and to process the digestion the way it should. So what happens is you get indigestion and it leads to heartburn and reflux. This is a very common situation. So it's very important that you give yourself a little bit of time to eat properly, digest properly. Try to take it easy when you're eating. Avoid walking and running around while you're eating. This is an important thing. Also, equally important is to not drink ice water. In the United States, we love to drink huge glasses of ice water with our meals. And you have to realize that this ice is detracting from your stomach chi, and it's making the stomach a little bit it's taking the energy out of your stomach, so then it has less energy to properly break down food, to properly do uh, its normal breakdown and metabolism of food. So the ice water is a big detractor from your digestion. So don't eat ice water, just have regular room temperature water. As they do in Europe, they always have room temperature water. It may seem like a significant change, but you'll notice a significant improvement in your digestion when you're not cooling down your stomach, taking away its energy. So it's important lifestyle things for you to keep in mind so that you're able to benefit from that. So moving right into some acupressure points on how to deal with the reflux and heartburn. First one we're going to look at is REN 12, which is going to be right between the xiphoid process, right between the sternocostal angle. So if you look at where your ribs meet, the angle right there, and then you go down to your navel and go right in between. REN 12 is a point on the center line, right in the center of your stomach, between the joining of the ribs and the navel. So you just take your fingers and massage gently, just massage press into that point. And this is a major point for strengthening the effects of the stomach, strengthening its function. So that point on the center line is very important. Next one we can look at is stomach 36. And here I'm going to show you, do a little demo of this point on the leg. So when you have your knee, you place your hand on the patella and four finger widths inferior to the patella, just outside of your tibia, where you can feel your shin bone, is stomach 36. And this point here, you're going to massage with your knuckles like so. You're going to massage this point, stomach 36, which is just inferior to the knee and just lateral, just to the outside of the shin bone. Stomach 36, very important points to strengthen your digestion, all of your digestive function. Thirdly, we have PC6. This point's particularly good for nausea if you have any indigestion. 2 inches inferior to the wrist crease, between the two tendons on the inside of the forearm. So find the two tendons, clench your fist, you can see them, and 2 inches inferior to the wrist. Just massage that. You can use your thumb and just gently press, knead that. And this point here is good for calming. It's good for any kind of indigestion or nausea in the abdominal area. Those 3 points can be very effective to treat heartburn, reflux. You have to do them consistently. Do them in between meals. So don't do them right before or right after eating, of course. Do them when you're nice and calm and relaxed. Find a time to do them every day. And with consistency, they'll get you results for reflux and heartburn. It's also very important to realize that the long-term use of probiotics, while it's always been known that it's helpful for the lower GI system, the intestines, now we also know that it's beneficial for the upper GI system, such as the stomach. So probiotics can be very helpful for long-term management of reflux. So I wish you very well. Thank you very much.